Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kosuch. So welcome back, everyone, to another episode of Patient Journey Pioneers. Today will be pioneered by Danielle Rodriguez, Senior Director of Customer Excellence, and Julian Ammons, Director of IT Digital Cloud Development Operations at Baptist Health. Danielle and Julian, it's great to have you on the show, and not to mention, as fellow Hyro customers, great to have you.
Thank you. Great to be here.
Same. Great to be here.
Julian, you were saying that your job title is so long, but we can sum it up by?
Yes, it's a very long way of saying that I'm the director of our development department.
Which is a lot. I mean, it's you shortened it, but still the same scope of, lots of stuff to do every day. So Before we begin, let's have one of you share a bit about Baptist Health as an organization, and then we'll hear about what each of your role entails today.
Sure. So I can take that one. So Baptist Health is located in Northeast Florida, so kind of the tippy top, right by Georgia. And it's a locally governed health system with 6 hospitals and over 200 primary care and specialty care practices. I kind of like to stress the locally governed. I think that's a really awesome fact because the individuals who serve on our board know our community very well, and they're able to kind of voice those concerns. And that gets directly back to the other leaders and senior leadership at Baptist.
And then do those trickle down to you right after conversations, or how does that work?
We're trying to work through that through our governance process. So yes, we're starting to hear of those.
Got it.
Julian's laughing.
Definitely a trickle down.
Give us one juicy trickle down that you've been getting lately from, I don't know, patients, the population in general.
Well, I mean, the population in general, with everything that's been happening in the world, a lot of it's been centering around AI. And so we have been getting a lot of trickle down questions and conversations about how are we going to incorporate and integrate AI in our environment. And from a development perspective, it's a very exciting time because we're like, yeah, we get to do new and cool things. But it's also a very stressful time because we're like, yeah, we get to do new and cool things. So, it's fun.
I always hear from our guests that AI in healthcare specifically is this double-edged sword. You get really excited about it, but due to healthcare's unique nature as an industry with its precautions and policies and protocol, it's not as easy to implement it safely and responsibly. So you guys are really at the forefront of choosing the right balance and how to best implement it. So we'll get there. But before that, I just want the audience to get to know you a bit better. We know you very well. Danielle, back to you. Can you share a bit about what it's like to be Senior Director of Customer Excellence, how you measure your success in your role?
Sure. So I've been at Baptist Health for about a year now in this role, and I oversee the service desk and our field engineering team. So our boots on the ground at the hospitals, and then our first line of support for any customers that are reporting issues. And then I also oversee our service management team. So that's, anything from incidents, so break fixes, to request, access request, and then major incidents as well, or system outages. So day to day, no day's the same. It's very fast paced. We're usually responding to something that is on fire, or, a perceived issue that's been escalated. So I think it's a very fast paced and not boring environment. The way that we measure success, we just went live with ServiceNow in June of last year, right before we went live with Epic. And so we have been using some KPIs to measure our success with our customers. So how quickly are we able to respond to their incidents and resolve them? When we do have a service disruption, how quickly are we able to get them, back up on time? What does our change velocity look like? Can we increase that at all? And so using some of those key metrics to really see, are we adopting process, and is our customer feedback where we would expect it to be?
Very cool. Julian, tell us a bit about your role and how you measure your success.
Oh man, so my role in the development role is really more about um, identifying those gaps that we have and finding creative ways to bridge those gaps. A lot of sometimes sometimes it's whatever Aaron will get the pulse of the industry and he'll come and be like, hey, it'd be cool if we did this, which is one of those fun and exciting times and one of those scary times. Sometimes he comes with he from the pulse of the industry, he'll come and be like, hey, Julian, I just read this article. What do you think? And I'm like, oh. Okay, so those are the exciting times. And a lot of our measurement is really based off of what we do for the industry and how we or what we do for the organization from a value perspective. Not necessarily the value that we perceive or the value we get from requirements, but also looking at it and saying, okay, we said we were delivering this value, and then coming back and saying, did we actually deliver that value? So a lot of our success is measured by what our customers, the feedback we get from our customers, and that value. And for me, it becomes a personal thing. I've been at the organization for almost 4 years now, but I was actually born in the downtown hospital. So I've been I've been
Wow.
associated with Baptist for the whole of my life, which we're not going to say how many years that is, but a lengthy life, let's put it that way.
In your 4 years at Baptist, what is something that you kind of look back on throughout your years in this role that you've learned from patients or even from clinicians or the patient demands recently that you're sure other folks in your role are facing today? And how are you kind of addressing those needs or challenges?
So for me, one of our patients are two of our patients are my parents, and so I get a lot of feedback from them, and they're constantly asking me, when are you doing this? Why aren't you doing this? When are you doing this? And I'm like, calm down. And also happen to be married to one of those nurses that's out on the floor, so I get a lot of feedback there as well. So I get home, I get my parents calling, telling me what they liked and didn't like, and I get my wife telling me what I need to fix. At the end of the day, the biggest thing that I saw when I got here and that I wanted to eliminate was paper. If we anything that we had going on paper, I'm like, what can we do to make that electronic to make it better? One of the complaints I get from my parents is, hey, how come I got to fill out so much paper when I go to the doctor? I don't like doing that. So how can we make it better? Not saying that my parents are the baseline, because truth be told, I love them to death, but they're kind of weird. But I take that feedback and play it through and say, people in their demographic that are doing what they do may feel the same way. So that's probably one of the biggest things from a patient perspective, eliminating paper, and from a team member perspective, anything that we're documenting on logbooks that's written down on, or anything a nurse has to pick up a pen and paper and do, how can we get that electronically so that they can spend their time at the bedside where they need to be as opposed to writing things down when we have a fairly large investment in an electronic health record that we should be utilizing to help to supplement their already deep nursing skills.
Danielle, anything to add before I ask Julie another question?
Yeah, I mean, I'd agree with that. I think, for us, our direct customers are our Baptist Health employees. And so, what we always kind of try and relay is when a clinician, is calling into the service desk with an issue, the faster we can get them, fixed and ready to go, the faster they can get back to patient care. So how do we make the most of their time so they can give back not only to the patients, but also get back time with their families?
Right, right. Which is the purpose of AI, and we barely even got 2 minutes into this episode without mentioning AI. Julian, what are you incorporating today? Or Danielle, of course, you can also share from your experience. What are you incorporating today when it comes to AI and automation?
So I think, at least from our perspective, a lot of the things that we're doing is looking at any tasks that are out there that are just, everyday monotonous tasks that a human is having to go and touch. We're saying, okay, how can we give that time back to the organization? Specific examples off the top of my head, revenue cycle is an area that comes to mind, claim status and things of that nature. We're looking at that and saying, how can we automate that? How can we make it easier for them to focus on those claims that require direct attention as opposed to, submitting it again and going back and forth. So items like that fall into that category are really where we're looking at integrating AI to make life a little better.
Yeah, and on that same token, we are also looking at that with our SRE teams. Our site reliability engineering team has just kind of relayed about 20 examples of automation that we can take and implement in the system to help our IS staff be more efficient in terms of service delivery.
So we'll jump to your recent project, Baptist Enterprise Linguistic Learning Environment. Very long titles in this episode, but fancy. You like to call it BELLE, BELLE. Can you tell us a bit about this project?
Bell came about because we found some spaces in there where we actually saw things that could be automated. And actually, I ran into someone from Hyro there at at HIMSS. I accidentally ended up going up to the booth, and Scott Heatherly ended up talking to me for a few hours, and now we meet every 2 weeks. But we identified some areas in there that we thought could be of assistance. One of the things we saw was and you know seeing the service desk, and I've interacted with them before. They were getting a lot of calls about password resets, and people just saying, "Hey, I need my password reset." And those guys on the service desk, they are brilliant. They're smart guys that their time could have been spent in other places doing things that could innovate. And selfishly, I want them to do things that would make my life easier too. So we were like, I wonder if we could automate doing passwords. And then Danielle was tolerated me for some time bugging her about it. And then we got it together and we pieced it in, and we needed a name. And Bell is what came up with. Bell is like the third iteration, actually. We went through about three different names, and Aaron and I sat down and got sign off from people smarter than us that told us when we were crazy and making up what they called a name that didn't make any sense. And we landed on Bell. So that's kind of where we ended up with that process and how we got there. Partnering with Danielle and the team over there, we were able to build something to make our team members' lives easier and make the service desk lives a little bit easier as well, so that they can focus on all my other crazy questions that I have.
There you go. There's always room for more, Danielle.
Yeah, no, it was great. And Julian says tolerated, but he really helped us out on the service desk because we saw once we implemented password resets, we had about 60% of our calls deflected. And so it really returned time back to the service desk to handle other calls, and we saw our service levels increase, and so it was really a good thing all the way around.
Danielle, you were mentioning patient satisfaction. When you two are implementing digital innovation in an organization that's used to one thing, and now you have to kind of elbow your way through into making this change, what are tips you could give executives who are about to embark on the same project in their organization?
I'd say the first tip I'd give is you have to go to them. We had to find the meetings that the nurses and the providers were already having and get some time on their agendas to kind of show them the benefit of what we were bringing. And I think the other PowerPoint is the messaging. How do you communicate how this is going to benefit them? Because you can make it real technical and real fancy, but if they don't really understand the impact in a quick way, you can lose them pretty quickly. And there's still been challenges in terms of communication, but I think that was probably the biggest lesson learned is that we have to go to them to get those messages out.
Just add to that, Danielle, one of the biggest things that I've seen is what we were working on this was the culture. If the culture of an organization is, I'm going to pick up the phone and I'm going to call, that culture is hard to break. And as I walk the floors from time to time, I'll go and I'll bump into nurses and I'll talk to some of the nurses, maybe a physician while I'm there. And one of the things that they talked about was, I don't want to talk to that robot. Give me a human. I still remember my interactions with the first AI I came in contact with. It's called Claire, and I hated talking to Claire because she never got it right. I have a southern drawl when I talk, so she didn't understand anything I said. But breaking that culture of the robot doesn't understand me and getting them to understand that this isn't that we don't want you to talk to a human. This is that we want you to talk to a human when you get to the point where it's something that the robot can't handle. Getting that understanding and changing that culture is difficult at times, and it doesn't happen overnight, and it's definitely more of a marathon than a sprint. So that was one thing that I would say just be cautious of as you start to work into this new AI world.
Yeah, that's true, Julian. Sorry. I was going to say that omni-channel presence is important, especially with the different generations that we have. Like Julian mentioned, you have those that want to talk to somebody, and then you have those who don't want to talk to anybody. They want a chat bot or something quick. So yeah, it's important.
Yeah, you guys are like serving patient demands, but when we say patient demands, it's not patient digital demands because some are from a generation that just want to speak to a person. So you're serving this like wide spectrum of generations and skills, and some are more tech savvy than others. And so that's a challenge within itself. Anything else you want to add as kind of main tips for folks who are about to embark on this journey marathon?
Make sure it works.
Yes, test, test, test.
Yes.
Yep.
No, well, honestly, we've had everything we've done with Hyro has been really, it's just been really enjoyable. Like what we've put out there has just functioned and it's worked for the end user to make their lives easier. But I've been in healthcare for some time now, and I myself have put some apps out there that, you know, they worked, but they had some bugs. And when the end user got a hold of it, they were like, this doesn't benefit me because while it does what you said it would do, it there are error messages. It does these things that I don't want it to do, and so the value is not really there. So we have to be certain that we deliver on what we say we're going to deliver on, give them what we say we're bringing the value, so that we can continue to have trust. They can continue to have trust in us to be able to do that.
Especially when they're making such a habitual change.
Hmm.
So, looking into the future, where do you envision Bell being utilized within Baptist Health in the next like 3 to 5 years, which I know is actually a short time in healthcare? Like maybe I should say 10 years. Like, how do you anticipate it'll further improve interactions and overall operational efficiency?
So I and this is I always tell people it's the gospel according to Julian, but I kind of look at Bell as like a wrapper around our organization where a lot of areas there's a gateway for patients, a gateway for team members to say, hey, I want to do XYZ, and it guides that process. We're already looking at integrating it into our intranet. We've already integrated it. I'm gonna stop calling it. I'm gonna integrated her into our into our patient portal. So now the same benefit that our team members are getting by calling and resetting their passwords, our patients can now do that in an area that used to, it was a call to our patient portal desk. Now it's Bell saying, don't worry, I got you. I'll reset your stuff for you. So I could see us continuing to move in that direction and treating Bell like an entity that's there to provide some additional value to our team members by taking some weight off of them so they can focus on more higher level innovation and an integration point for our patients and our customers so that they can, for those quick things they need taken care of, they have her there to be able to service those needs.
I feel like Julian said it very well. I think, in my direct line of sight, we're looking at additional use cases, that we can use on the service desk in addition to password reset. So that was kind of just the tip of the iceberg. As Baptist continues to grow, the need for bodies to support that growth is going to increase. And so the more supplemental tools that we can have out there to help our staff be more efficient, the better. And so just looking for new and creative ways to do that is kind of where I see us going in the next 3 to 5 years.
So when we celebrate Belle's birthday next year to have you back on sharing, Baptist's recent innovations, how old will she be?
Next year she'll be two. So we took Bell live, I believe, July 30th of
Yes.
last year. So when we come back next year, she'll be coming up on
Okay.
her second birthday.
Yep.
Okay. Young but doing amazing things already. Wonder Woman.
Yeah. Baptist likes the summertime to do things.
We pack it all into those 3 months.
We do.
Well, I am going to get time on your calendars during those crazy months as well to have you back and share what's new with you guys. So this was amazing. And to end this off, I always like to ask for kind of 1 to 2 career tips that you would give anyone listening who is also a digital healthcare executive in a large healthcare organization with demands, dilemmas, challenges, this ever-changing ecosystem that we all have to kind of stay up to date with. Danielle, let's start with you. Maybe 1 to 2 tips to walk away with.
Yeah, I think the first tip that I always give my team is just to remember that at the end of the day we have patients out there. I think it's easy to lose sight of that in IT, especially if you're working from home or you're working from your desk and you're not rounding the floors. You don't get to really see the impact of the work that you're doing, and so I like to try to remind them to take a minute back and just reflect on the impact that they're having and to be empathetic and really listen when we do have customers that call, because even if it seems like it's not an issue, we're probably just not understanding it or speaking the right language. And I think that my second tip is just to grow your network. I think that that's probably single-handedly been the most useful and helpful thing for me in my last few years in my career. Just having somebody to kind of go back and bounce ideas off of or ask, hey, how are you doing this? Just so we're not always having to recreate that wheel.
Julian?
Oh man, if I had to come up with just two, the number one would just be listen. A lot of the ideas that we get for some of our applications and some of the development that we do come from just listening to meetings or walking the hallways and hearing people talk. And you would be surprised what people will say when they, if they, one, don't know who you are, and two, don't realize that you're actually listening. So when, like, a lot of times I'll hear nurses or doctors and they'll be like, It's silly, we should be doing this." I actually went to the doctor and I was in the room with my physician who didn't know anything that I did. He just knew I worked at Baptist, and he was telling me something about the system that he just really didn't like. And he's like, "I wish we could do this, this, and this." And I was just writing it down. And on the way out the door, I told him, I was like, "Well, I'm actually over the development department, so I'm going to call you later and we're going to figure out how to get this done." And we did. We were able to sit, talk, and we were able to build some things to help him. So listen and engage from that perspective. And the second thing, don't be afraid of failure. Yes, test, 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 test. But even if you test and everything is perfect, there's going to be that app that you release that no one ever uses. Don't be afraid of that, because I don't know how many times, I always mess up the number, but Thomas Edison said he had tried, like, I think 300 or 3,000 or however many times to build that filament for the light bulb. And when people asked him about it, he said, "I didn't fail that many times." He said, "I just found, 299 ways not to make a light bulb." You learn from every single failure that you have. You just have to continue moving, and eventually you'll get it right. I'm the baby of 4 children, so I tell my parents, like, you all finally got it right. When you got it right, you stopped having kids. So there you go. But that would be my two: listen and engage, and then of course, don't be afraid of failure. Just keep moving forward until you get to the destination that you want to arrive.
Very inspiring stuff. And also from our end, we want to thank you for believing in Hyro. We actually just recently had our Series B round, and so we were celebrating that. And we always like to tell our customers that we appreciate them believing in us. It's the B for Series B. And for being on this journey with us to bring patient journeys to new heights. And also thank you for now being official patient journey pioneers, now that you've participated on this podcast and sharing your best practices and challenges and some personal career advice. So I had a great time on this episode, and I want to thank you again for your time.
Thank you.
Awesome. Thank you.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.